Hello and welcome to the next episode of our implant video blog. So today we're going to talk to you about the implant placement appointment. So we've finished all the planning. We've virtually placed your implant using your CBCT scan and our clever computer software. We've got your surgical guide which is ready to go, ready to fit to your teeth when we're placing the implant. So all the planning's done, which makes this appointment go a lot easier, a lot more comfortable for everyone, makes the appointment a lot more efficient as well. We place the implant under local anaesthetic, so we use the same local anaesthetic that we'd use for fillings or extractions. It's no different. Sometimes we'll place the implant under sedation for patients that are nervous, which works very well for patients that are anxious about the procedure. But usually it's done under local anaesthetic. The other thing to note is we do place the implant under sterile conditions. So Amy's just finished setting up for our implant today. So she's got the surgical gown, the sterile gloves, etc. So this can be a bit daunting if you're not prepared for it, but it should be reassuring. Really, we're just taking our infection control very seriously because we don't want to introduce any infection when we're doing the surgery. Anything else I've forgotten, maybe?
Yeah, the surgery usually takes around about 90 minutes from start to finish. We make sure that you're really numb before we begin, so we give you lots and lots of anaesthetic, and then I cruelly try and make you have a mouth rinse afterwards. Most patients report that the whole experience is very similar, if not better, than having a tooth taken out, which is quite nice to hear. After we've placed the implant, we do pop in a few stitches, which we then get you back in a week later, and we remove those stitches.
Yeah, so after the suture removal appointment will be in a week's time after we place the implant, and then we'll generally leave our patients alone for a couple of months then for the implant to integrate with the bone before we put a tooth on that implant. And we'll be talking about those stages in our next on our next blog. So thank you very much for listening, and we'll see you again soon.